has visited a dentist 4 times in less than 1 year for toothache. She has lost three of her teeth and she's at the verge of losing the fourth one. Amaka's mom also had toothache, and Amaka's 6-year-old son is also complaining of toothache. Now, Amaka is beginning to think that there is something wrong somewhere. It's either this thing is spiritual, it's probably from her village, or there is a genetic component, right? So Amaka comes to the dentist and she wants to find out, is there something wrong with us fundamentally? Why is it that my mom is dealing with toothache, I am dealing with toothache, and my son is also complaining of toothache, right? In my period of practice, I've also had people ask me the same question. Why do people who belong to the same family usually come down with toothache? Why are my siblings having toothache? Why am I having toothache? Why are my children having toothache? And all of that. So here is the thing. Presently, as of today, I haven't come across any study or any research that proves that toothache is genetic, right? However, there are studies that have shown that certain behaviors can actually predispose you to coming down with toothache. There are a number of things that when you do repeatedly, you're definitely going to come down with a toothache. It's not rocket science. I'm a dentist, and if I live with you for a certain period of time and I observe your habits and your diet and some of the things that you do, I can predict whether or not you're likely going to come down with a toothache or not. And it's not a mystery, and I'm going to explain that to you. So before I go on, let me explain to you how you come down with a toothache. Because if you understand the process, then you can now understand how not to come down with a toothache. So simply put, there are about four things that must be there for you to have cavities. You have your tooth. If you don't have any tooth in your mouth, then you are not going to have toothache, right? You have the microorganisms that cause these cavities. You have the food that these microorganisms feed on in order to be able to bring about these cavities, and you need time, right? So you have these four things, and they have to all play a role for you to have cavities. It is these cavities that cause you pain. Now, let's break it down. So you could be wondering, how do microorganisms get into the mouth? I brush my teeth every single day. Yes, we know. Your daily brushing cannot get rid of every microorganism in your mouth, because some of them have good roles that they play, and then you have the ones that have bad roles that they play. So back to the conversation. Now, when a child is born or when you were born, your mouth was clean, sparkling clean. There are no dirt, there are no microorganisms in it. Everything is clean, squeaky clean, literally. So, how do microorganisms get into this child's mouth? Good question. They get into the child's mouth by sharing utensils with that baby. Mothers that feed their baby and lick off the other remnants from the spoon to feed the child. You're transferring the microorganisms in your mouth into the child's mouth. Mothers that feed their baby, and instead of using the napkin to clean up the mouth, they use their tongue to lick up the excess. Yes, you are transferring the microorganisms from your mouth to your child's mouth. Mothers are eating their food, and when their baby giggles and laughs, they take that same spoon they are using to feed themselves to feed their baby. They are transferring the microorganisms from your mouth to your child's mouth. And I'm using mothers here. I mean, of course, there are other people who feed children that are not mothers. You could be a father, a sibling, an aunt, a caregiver, whoever it is. Yes, when you do that, you're transferring the microorganisms from your mouth to the child's mouth. And kissing, there are many people that are fond of kissing babies, and not just on their cheek, on their skin, on their lip, in their mouth. They literally stick their tongue inside the baby's mouth. That is a no-no. You're also transferring the microorganisms in your mouth to that baby's mouth. So when you succeed in doing that, this baby now has microorganisms in his or her mouth. And what do these microorganisms do? They would proliferate, they would get bigger, they will increase, and they will multiply. And in the process of doing that, they need to feed, right? They cannot multiply without food, they need to feed. But there are things that they like to eat, because the microorganisms, they do not have the complex system that we have that can break down different food substances. So there are things that they like to eat, because those are things that are easy for them to break down. And many of those things are very unhealthy. Think about your ice cream, your sweets, your chocolates, your pastries, your biscuits. Just think about any of these things that are made with refined carbohydrates. These microorganisms, they like those things, right? So you already have the microorganisms in your mouth, and then you now eat a lot of sweet things, a lot of refined carbohydrates. You're already providing food for these microorganisms to eat and thrive. But that is not enough. It needs time. So when you do not brush twice daily, or when you don't get rid of this food in different parts of your mouth, Yes, you're giving these microorganisms enough time to feed on them, to feast, to enjoy, to have fun. And in the process of feasting on them, they produce acids that damage your teeth. I've talked about this in one of my videos. What happens when you don't brush before going to bed? I'm going to be leaving the link in the description box. If you haven't seen the video. So yes, if you do not brush, those microorganisms have enough time to eat the remnants of the food in your mouth, break them down, produce acids, and it will damage your teeth. Now, for someone like Amaka who is thinking, is this genetic? The thing is that when a child is born, the child doesn't really know anything. The child cannot really decipher different meals and what is healthy and what is not healthy. So, if you as a parent you eat a certain type of food, chances are your child would also grow up eating that kind of food because your children are going to eat the kind of things you eat. So if you have a sweet tooth, you like a lot of chocolate, you eat a lot of bread, you like a lot of ice cream and all of that, eventually your children are going to also like the same thing because that is what they are used to seeing you eat, and they are going to start eating those same things, right? Now, if you also have the habit of not cleaning your teeth or brushing twice a day or using a fluoride toothpaste, your children are also going to grow up without using those things. And when they do, they would eventually develop cavities, the same problem that you have. So you're seeing how this is perpetuating itself basically. You have a condition and your child has that same condition, and their children are likely also going to have that condition. Not necessarily because it's genetic or it has a spiritual connotation, but it's more of a habitual thing because when you do something, your children learn those things from you, and then they do it, and then their children learn it, and then they also do it. So yes, that is how you come down with a toothache. So what are the things you can do not to ever experience a toothache? I'm sure you may have figured some of them out already, but I'm still going to spell it out, right? Just to make it clearer. The first thing you can do is not to share your utensils with your baby or your siblings or with people randomly, right? Not just because of cavities though, but because there are other harmful organisms that can be transmitted through the saliva, and you don't want to be a victim of any of those things. Now, that aside, now that these microorganisms are in your mouth, right? It's okay, it's fine. They will not kill you, at least not yet. What are the things you can do in order not to come down with toothache? Now, brushing your teeth is like, I've said it a number of times, it's like a magic wand. Like it solves a lot of problems even before they occur. So if eating all those things, you have those organisms in your mouth. When you brush with a fluoride toothpaste, the fluoride strengthens your teeth, makes it less susceptible to these microorganisms. One, and then the toothpaste also has, to an extent, antibacterial properties that help kill microorganisms, the harmful microorganisms in your mouth. So that one, you've gotten rid of a large number of these organisms that can cause this problem, right? That one is solved. So let's assume you're just coming across this video and you already have a hole on your teeth and you don't know what to do. It's fine. Holes are not reversible, but there is something that can be done. And that is where visiting your dentist every 6 months comes into play. If you visit your dentist 6 monthly, the dentist is going to evaluate you holistically, look at your oral health, assess your oral hygiene, tell you the things you're supposed to do and the things you're supposed to stop doing. Basically, some of the things I'm saying to you right now, but tailored specifically to you. So when you visit a dentist and he or she evaluates you, the person can see when you have tiny holes. These holes that you may not even feel them, right? They are not causing you pain. You're not feeling any sensitivity. They are just there sitting pretty. So this dentist is going to see these holes, and this dentist is going to advise you to fill up the holes. Now, there is a category of people who say, no, it's not paining me. There is no need filling it up. These are the people who usually fall victim to toothache because those holes do not seal up on their own. Those holes do not heal themselves, right? What happens is that it keeps getting bigger. The best thing that could possibly happen for you is that it stops progressing, right? But it can only stop progressing if you improve your oral hygiene. If you maintain the same previous oral hygiene that allowed the hole to form, the hole will keep getting bigger. Now it keeps getting bigger. You start feeling a bit of discomfort, shocking sensation to cold water, shocking sensation when you take sour fruit, shocking sensation when you brush that side, and then it progresses to slight pain, the pain you feel when you bite. And from feeling pain when you bite, you just start feeling pain just like that without you doing anything. And this pain progresses to the point where it becomes worse and unbearable at night. Now you have to run to the hospital. Sometimes it could even get swollen, sometimes it could spread to your airway and it could get really, really bad, right? So how do you stop all these things from happening? The dental visits. When you visit the dentist and there is a hole on your teeth, just fill it up immediately. Even when the hole is not paining you, fill it up. Now, when it gets to the point where you start feeling pain, your treatment plan may change. The dentist may start saying something like, "Oh, you need a root canal therapy," and all of that. As much as you can, please listen to your dentist and carry on with whatever treatment he or she says is best for you. That way, you're keeping yourself from coming down with frank toothache, and the pain is excruciating. Trust me, it's not something you want to experience ever. So, yes, these are some of the ways for you not to have toothache. I'm just going to recap. First things first is not to share utensils. If you're parents, get your teeth cleaned regularly. If you also get your teeth cleaned, you reduce the number of microorganisms in your mouth. And by reducing the number of microorganisms in your mouth, you also reduce the chances of you transmitting these organisms from yourself to your child, right? So even if peradventure there is an exchange of saliva, which I do not recommend, because you already have a very good oral hygiene, the chances of transmitting these organisms are reduced. That's the first thing you can do. The second thing you can do is to eat healthy. If you eat healthy food, if you avoid or reduce your intake of sugary things, refined carbohydrates, and all of that, you also literally starve these microorganisms of the substrate, that is the food they need to eat in order to survive, right? So when you starve them of it, they don't really have anything to eat. And if they don't have anything to eat, they won't produce any acid that will damage your teeth, right? So that is taken care of. The third thing for you to do is to brush, right? Regardless of what your diet is, brushing is like a normal hygiene thing that everybody is supposed to practice, regardless of your diet. So you can't say, oh, I eat healthy, I eat only fruits and vegetables, so I don't need to brush. No, my dear, you need to brush. Brushing, but not just brushing with any toothpaste. Yes, now. I mean, are there people who are still using dental powder? No, 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 no. I mean toothpaste. We've already gone past dental powder. Dental powder is like in the early hundreds. We are talking about we're in the 21st century. Toothpaste, yes, with fluoride in it. So when you go to get your toothpaste, check whether it has fluoride, especially if you're living in a place where there is no fluoride in the groundwater. It's important that you use a fluoride toothpaste. So the fluoride is going to help strengthen your teeth, make it less susceptible to damage by microorganisms. And then visiting your dentist every 6 months. You don't have to wait till you have a toothache. The visiting the dentist is where you go and then they clean your teeth, the scaling and polishing. That's the professional teeth cleaning. So that's what they do basically. And in the process of evaluating you, they see whether there are any holes that need to be filled up or any things that you need to improve in your oral hygiene. If you do all these things and follow them judiciously, you reduce your chances of coming down with toothache to a great degree. The other thing I didn't mention is flossing. Part of the reason I didn't really scream about it is that many people don't know how to make use of flosses. So I see people coming down with traumatized gingiva because of how forcefully they make use of their floss. So they damage their gum in the process of trying to clean it and all. So sometimes I just feel like just do your brushing, right? Your morning and night brushing with a fluoride toothpaste and the right brushing technique. But if you can floss, of course, perfectly, that is totally fine. Please go 360. But yeah, basically, these are the things you can do not to ever come down with a toothache. If you have any question, let me know in the comment section. Please remember to subscribe to my channel, give this video a thumbs up and share with your friends. I'd really appreciate it. Take care of yourself and see you in my next video. Bye.